Good afternoon. We'll get started. Welcome to the webinar on early care and education as a local COVID-19 relief measure. I'm Libby Saunier, the Executive Director of the Louisiana Policy Institute for Children. The Louisiana Policy Institute for Children seeks to be a source of nonpartisan independent information on issues concerning children ages birth to 4 in Louisiana. We also develop policy proposals informed by data, research, best practices, and the experience of other states for improving the outcomes of Louisiana's young children, and then provide educational and outreach activities such as this one with the webinar to really help recommend policy solutions that support our youngest learners. I'll kick it over to Ruth Ann Oakey-Frost, the Policy Director at the Louisiana Policy Institute for Children, as well as Scott Tippett with Save the Children Action Network. And again, thank you all so much for joining us today.
Libby. As Libby said, this is Ruth Ann Oakey-Frost. I'm the Policy Director for the Louisiana Policy Institute for Children. Thank you all so much for being here. If we could go to the next slide, Rita. So we have two objectives of this webinar. The first is to inform participants about funding opportunities for local governments to invest their COVID-19 relief dollars in early care and education. And I'll be discussing that objective. And our second objective is to support participants to advocate for usage of those COVID dollars for early care and education. And Scott Tippett of the Save the Children Action Network will discuss that. And at the end, we will have time for Q&A. So feel free to put, if questions come up as we go along, to put them in the chat box. So just a brief overview of this funding opportunity. Louisiana is making funds available to cities and parishes for COVID-19 related expenditures through the recently passed SB 189. That allocates $524 million, and there's a breakdown based on population, how much of that $524 million is allocated to each geographical region of the state. Cities and parishes have the opportunity to use these funds to invest in early care and education as a COVID-19 response measure. What does that mean? Well, funding early care and education ensures that parents can go back to work, the young children can learn in a safe environment, and that local businesses have a reliable workforce as the economy opens up more and more. And we move to different phases of the response to the pandemic. So cities and parishes have to submit their applications to the Louisiana Division of Administration for the reimbursement of their COVID-19 responses. Can we go to the next slide? So the reason why we are suggesting to all of you that we should start making the case for early care and education is that, one, it's essential for pandemic response and economic recovery. Investing in this industry supports all other industries. It helps the local workforce return to work as the economy reopens. Two, parents need childcare to look for work and be productive in the workforce. We are facing record levels of unemployment. In addition to people struggling with working from home with their young children at home versus like when their physical place of employment has reopened, and what are they going to do when they have to return to that workplace. The lack of affordable, reliable, quality care has been a significant barrier to workforce productivity and participation even before the pandemic. And so obviously it's a really significant problem now. And investments in early care and education have far-reaching impact. Studies show that there's a 13% return on investment. And right now there's a tremendous need because, again, even before the pandemic, Louisiana was only serving 15% of children below the age of 3 who were eligible to receive publicly funded early access to early care and education. Can we go on the next slide? Obviously, like all businesses, COVID-19 has had a serious impact on the childcare sector. Childcare providers are economic anchors in our communities, and they must remain open if people are able to go back to work. But because of COVID-19, childcare businesses are facing increased costs due to the pandemic. For example, cleaning supplies and food cost more. They haven't budgeted for those things. They didn't budget to buy masks and extra hand sanitizer and thermometers. And now they're having a difficult time securing it. Our organization has done several surveys of childcare providers, and this is pretty routine that they're all struggling financially. In addition to all that, for safety reasons, in phase one, the child to teacher ratios were going down, and in many areas they're still lower. That's to preserve the health of the children and the teachers, but it also cuts into their profits, because if they can serve fewer children per teacher, they're obviously not making as much money as they were. Many of these businesses closed temporarily at the beginning of the pandemic. Some may close permanently. Can we go to the next slide? So this is what brings us to how can localities invest in early care and education as a COVID response measure? Well, one thing they could do, and again, this is going to differ depending on where you are in the state. Every locality knows their individual needs best. So these are just suggestions to start conversations. But the first thing they could do is they could use their COVID relief dollars to purchase necessary supplies for the child care centers. They could buy the PPE, they could buy the thermometers, the cleaning supplies, the sanitizer, and give it to the providers that are open and serving members of the community. They could use their COVID-19 relief dollars to provide grants to child care centers to help them reopen or stay open. The Louisiana Department of Education is doing this as well, but we know that there is a greater need than there is available funding. So that might be something that makes sense for your locality. Can we go to the next slide? Sorry, I'm all the pictures of the people up. Oh yes, additionally, governments, now, and this one is a little trickier, but they could use their relief dollars to fund childcare seats in the short term. Now, these dollars have to be used on expenditures before December 30th. So this isn't a way to expand access in the long term, but they could think about whether their essential workers, so their firefighters, EMTs, if we have a spike of cases in the fall, whether we need to provide emergency childcare like the department did at the beginning of the pandemic for parents who are now working later hours into the evening, working over weekends when previously they weren't. They aren't going to automatically have childcare for those situations. So each locality should consider whether that is something that they need and could do as a COVID response measure. The state already did do this. They used some of the CARES Act dollars to provide short-term childcare assistance to essential workers with young children, and to do those emergency services for when it was more of a outside traditional childcare hours. So we just wanted to invite local governments to think about these issues and whether that makes sense for their individual communities. Can we go to the next slide? All right, and at this point, I will turn the conversation over to Scott. So thank you all.
Thanks, Ruthann. Again, this is Scott Tippett with Save the Children Action Network. I'm the state manager here in Louisiana. So let's talk about what advocates can do. Advocates can mobilize their networks to share the two handouts with local government officials. Think about your mayor's office, your city council, a chief financial officer. There's a one-pager that talks about, invest in early care and education as a COVID-19 response. There's a guide, how governments can invest in COVID-19 response dollars from SB 189. And you can find these on the Louisiana Policy Institute's website. That's policyinstitutela.org and then /local-ECE COVID relief-19. So advocates can set up meetings with local government officials to review these handouts and make case for investing in early care and education as a COVID-19 response measure. Next slide. So I wanted to go over what we saw in the frequently asked questions that are relevant to advocates like yourself. And the first place to start would be that U.S. Treasury June 30th guidance. It's a 4-pager, but it really sets the corners for the program. So one of those things is a necessary expenditures incurred due to the public health emergency. Number 2, the costs cannot be accounted for in the budget most recently approved as of March 27th. The costs incurred, they have to be during a period of time that begins on March 1st and ends on December 30th, like Ruthann previously mentioned. The Treasury's guidance, that 4-pager, it does provide a list of non-exclusive list of eligible and ineligible expenditures, but we don't have time today to go into all of those. So I wanted to make sure that I provided you with a link to the FAQ where you can read more about this, but that's louisianacares.la.gov. Next slide. So the other frequently asked question I wanted to point out is the Louisiana Division of Administration's frequently asked questions. And there's a 10-pager, so there's a lot in there, but I've pulled out these two, which I think are most relevant in your advocacy efforts. What are the expense reimbursement application periods for 2020? There's 4 of them. And as you see on the left side is our expense reimbursement periods. And then there's the application periods where cities and parishes would submit their claims for those reimbursements. So right now we're in the June 1st through August 30th period. The application to submit for that would be September 1st through September 15th. I also think it's important to point out that one of the questions in the FAQ says, in the review and evaluation of claims, are there types of eligible expenditures that the state plans to prioritize for funding over other expenditures? And very clearly a no. So whether that's granting or expanding access, whether that's hand sanitizer, masks, or thermometers, as long as it fits within the 4 corners of the program, they're not going to prioritize those expenses. They will be paid. I think the other important thing to relay in terms of this timeline is that if a parish's allocation is not used by November 1st, the legislation in SB 189 allows for that money to be moved to another parish. So it's important that the parishes swiftly act to use these funds. Next slide. So we've talked about why it matters. We've talked about what parishes can do, some of the parameters, and now it's important that we talk about crafting your elevator pitch for advocacy. So, of course, the elevator pitch is not something we do as much in person anymore because of COVID-19, but there are 4 major parts to it. You may need to adapt it if you're talking to an elected official over the phone, leaving a voicemail, or talking to one of their assistants. But it has those 4 parts. It's got to be short. It's got to be personal. Why do you specifically care? Include the urgency. Why should someone care now? And there should be an ask, how can this person help? So here I've crafted elevator pitch. In this example, I might be leaving a voicemail. These days, it's kind of hard to get a hold of them sometimes, so you've got to keep following up. But hi, Councilmember Wicker. This is Scott Tippett, a constituent yours. I have a 14-month-old, and the first 3 years of a child's life are the most important for brain development. So supporting early childhood education is a no-brainer for me. In these uncertain coronavirus times, it's vital we support early childhood education centers because parents of young children can't re-enter the workforce without healthcare options. Today, I'm asking you to support struggling childcare centers by spending COVID relief funds on providing grants for increased cost of operation and expanding access for kids. So this is an example of an elevator pitch, but I think it's also important that I provide you with the resource to be able to know who your elected officials are. And the easiest way is to direct you to a Louisiana Secretary of State's website. That's voterportal.sos.la.gov. You'll click on My Elected Officials. It's a big, long list, but you'll see everybody who represents you and their contact information. And you can use that to deploy the elevator pitch, but also set up that meeting to give them the 1-pager to go over why it's so important in these COVID-19 times that we support early childhood education centers, and parishes and cities have a role in that. Next slide. And so with that, we wanted to thank you for joining us this afternoon. The toolkit with this information and recording of the webinar and these slides will be on the Policy Institute of Louisiana's website. You see the web address here. You can also read more about what's in the FAQs at louisianacares.la.gov. Remember, local governments should act swiftly to assist their communities with recovery efforts while the funds are still available. And if you have any other questions, Ruth Ann and our contact information is here on the screen. And at this point, we're ready for those questions.
It looks like we have one in the box from Timothy Magner. So SB 189 allows monies to be spent on early care, but does not require it. Yes, SB 189 lets local governments spend it on their COVID-19 relief measures. So if it fits within those guidelines that Scott described in the FAQs, there are obviously some things that are excluded from being able to be reimbursed, but no, it doesn't require it. So every locality is going to have they're going to have to evaluate their own local needs. And so what we're encouraging advocates to do is to reach out to their local officials to start this conversation and to like get them thinking about the benefits of using these monies this way, because it has such far-reaching impacts. We think it's like a good investment of these funds. So it will require specific requests to local municipalities to get them to dedicate SB 189 funds this way. We believe so. I think that some localities are thinking about this already, but we definitely do think that advocates are going to have to do the heavy lifting of talking to their local officials and encouraging them to think about it this way. Do we have any other questions? Please feel free to put them in the chat box. And again, I know that was a lot of information we covered really quickly, but so feel free to contact us afterwards. And yes, the next question from Candace, will this recording be made available later? Yes, it'll be on the Policy Institute website. If you go to, let me see, the link is up there. I can't move the chat box so I can read it, but we have a COVID-19 relief section on our website. You're welcome.
If you wanted to take a quick look at what the allocations look like for each parish, you can follow the link here, give you a better idea of what's in the relief fund and the allocation per parish. Again, as Ruth Ann mentioned, the fund has an overall amount of 524 million. And again, if it's not used by that November timeline, then it will be, it could be reallocated to a different parish to use. It is a use it or lose it type of fund.
Does it have to be used or just allocated? Okay, so the reimbursements, the expenditure has to happen by December 30th, but the reimbursements can come after. So if you have an expenditure on December 29th, you turn in that reimbursement in January and you can get it reimbursed in January, but the expenditures have to be done by December 30th. And then the reallocation is going to happen in November. So let's say that Orleans Parish and Jefferson Parish have used up all their money, but East Baton Rouge Parish has not used up all their money. So they're going to recalculate that at that point and then take the money that East Baton Rouge Parish has not used and make it available again to Orleans and Jefferson because they've used theirs. So that's why it's important to encourage local officials to get on this. And they are aware that they need to get on this, but definitely. So like the parishes that are efficient may see some benefit if the reallocation happens in November. Thank you. These are parish funds. Are there any city specific funds? So cities can apply for the reimbursements as well. Okay. So we'll go with Timothy's question about, so cities can apply for their COVID-19 responses, and there's actually like a list of political subdivisions that are eligible to apply. But the way the allocation works is they divided the state's population and put it, calculated out how much is a fair share for each parish based on their population size. So that's the document that Scott shared in the chat box. So if you live in a parish and you want to advocate with your city specifically to go after these funds, you should absolutely do that. Then Christine Jordan's question, I thought Scott said each parish needs to use its allocation by November 1st. It's complicated. So on November 1st, that's when they're going to recalculate and look at whether parishes have used up all their money or not. So it is important to get on this quickly, but obviously there will be expenditures after November 1st that people will still want reimbursements for. But November is when they will possibly be looking at reallocating the funds and giving them to the parishes that have exhibited greater need. So the expenditures are covered through December 30th, but applying early will have benefits as well.
I think the creative thinking from parish and cities is in that conversation about in the coverage of this local relief fund for parish and cities, the governor, the division of administration, and some of the members of the legislature are questioning whether or not cities and parishes can use all of these funds. And so we're also, of course, trying to advocate that, cities and parish recognize that this is an appropriate response. So, it could be that there could be a lot of reallocation, but if we are advocating to those, parish leaders or city leaders to use these funds in this way, there may not be as much of a need for that reallocation.
Thanks for the question. Is this in addition to monies dedicated to school districts? Yeah. School districts can they apply?
No.
No, these are different funds.
Yes.
The CARES Act had specific money for school districts. So this is a different fund. This is for, and we can,
I can pull up that link real quick for you.
Yeah, the list of eligible local governments. But yeah, the school districts have their own sources. So yeah, they should consider doing this as well. I mean, not they should. Local government should consider doing this as well because the school districts are covered in a different way.
So Timothy, I just dropped in the chat there the guidance or the frequently asked question that comes from the Louisiana Division of Administration. So
if you want to just read that in case people can, on the recording, I don't know if they can see the chat box.
Okay. Yeah, so it just says, number 3, are school districts eligible to receive reimbursement for funds allocated to local government units? It's just a one-word answer and it says no. So it would come from a different fund. Well, that's an interesting question though that you do bring up as well.
If the school district provides early care for, say, 4-year-olds, can dollars be used to expand their access? The school district is not eligible to apply, but I don't know what sort of individual structures each locality uses to serve kids. So I think that might be a case-by-case basis, figuring out who could apply in order to expand that sort of access. Sorry, we don't have a clearer answer on that one. That's a really good question.
Yeah, because I guess you could see a scenario where maybe a city or parish operates in some way, or at least I know of examples other places where that does happen. And so, or they provide funds in some way. But in terms of an actual school district, the guidance seems to say that that's not an option.
Mm-hmm.
And then I'll go ahead and drop the link for that one too, so you can hop over to that, Timothy, and see it's number 3 in there. But there are it does define a lot of those government units that would be able to apply.
And again, I think the reason for excluding school districts in this case is because the CARES Act had a specific funding source for schools. So I don't think it was meant to slight the school districts. Like I said, we will stick around until 1:30, but if people are needing to go, we really appreciate you stopping by with us and talking about this issue. And please do feel free to reach out if you have questions later. Email me or Scott, and we'll be happy to find answers for you.